All right, so let's start with the questions because I have a few, to say the least. Okay, so we've talked about a little bit about the fines. We're going to get back there because we get those details. But about just nursing care in general. Let's talk about just nursing care. Some nurses saying, the big guy upstairs telling me that I can only have 4 patients. What about our nursing autonomy? You've been a nurse for 20 years plus, right? So what
Can I
about...
ask you a question?
Please, hit me.
So you're a practicing nurse and you're short and you call your supervisor. How often do you get more help?
When we can. I don't know what the number is.
That's the thing. That's the problem, is that they're not staffing to the level that you need. The science shows that 1 to 4 number on med-surg, on pediatrics, makes sense. That the 1 to 1, and if the nurses agree, 1 to 2 makes sense. And the hospitals are not staffing that way. And if you read the Boston Business Journal recently, or saw the report in the Globe, the hospitals are profitable. If you were following what happened when we passed the ICU law back in 2014, the hospitals didn't, or not the, I'll say the hospital association, the partners, the big institutions, did not run away from the fact that there's money in the Cayman Islands that they have. So it's not as though there is not money. And the fact that, just again, going back to the Boston Business Journal, that these hospital executives who are making tens of millions of dollars or millions of dollars got double-digit increases in the past years. So, you know, we're talking about care.
Yes.
Okay? And what we want to do is make sure, based on the science, there are enough people at the bedside to provide the care.
So I do have to put it out there. So at my job, I am happy where I work, right? But
So
I feel like I'm lucky though. And I don't know, and I say this all the time to people that I've talked to in the past, that at my job, I've never had more than 5 patients. I've never had more than 5. I work on a telemed-surg for, it's 4 or 5 all day, every day, right? I've never had more than...
Are you step down, or they don't call you step down?
They don't call a step down. It's telemed-surg. It's
Right. Okay, so let me answer your question. I think your question, by talking to a nurse that I spoke to on Friday who works in the tele unit on my floor. And they were short-staffed. I didn't ask her the numbers. I didn't have to ask her the numbers because she was distraught talking to me. And she said to me, Nora, when I told them we needed help, they said, you're going to have to step it up. And her response to me is, when we've stepped to the top, there's no place else to step.
Yes.
So, you know, that is what we're talking about. We're talking about, you know, and on a tele unit, you know what the research shows? You go over 4, you increase morbidity and mortality. So you think you're happy, but the fact of the matter is the science shows your patients will recover better if you have that number.
Yes. And I'm not going to pretend that it isn't harder having more patients. That's just a lie. It's just no one believes that, right?
Right.
But back to the autonomy question. What if I'm at work, I see my coworkers struggling with 3 heavy patients. I have 4. I want to help her. You know what? Let me take that off your load. Let me help you out.
Let me help you, but not put it on my assignment.
How about when the nurse needs to go downstairs to transfer a patient?
Actually, it says they have to cover, that the hospitals have to provide enough nursing care to cover at all times.
At all times. So even if there's a code, and when someone...
Well, if there's a code, what nurse isn't going to help another nurse during a code? Is it harder for you when you have 5 patients, or is it harder for you when you have 4?
Obviously 5. That's not. I mean,
that's the deal. That's the deal.
But like the thing is, I know. I don't want to get into this.
Yeah, I understand. I'm sorry. I just
care.
I care so much.
Of course, and this is why we're having this conversation, because this is the conversation I'm having with every other nurse.
Yeah.
Right, and we're just. I don't want to say afraid to, but these are the kind of things that are just not aired out to say the least. Okay, so. I have to, my patient has, a brain attack. I need to take him downstairs to get an MRI. There's 3 more patients upstairs. I'm downstairs with my 1 patient. We were perfectly staffed prior. But now there's 3 extra patients. Is the hospital going to be in trouble for that situation?
If they aren't continuing to have the support services, I suspect yes, they are.
Yeah.
And I don't think that's a bad thing.
You don't think?
No, I don't think it's a bad thing, because no nurse should be taking 6 or 8 patients during that period of time. Okay. They should. Every patient should expect at all times to have the care they deserve.
And And I love that. I love that. Of course, in a perfect world, that is what I want. But I don't
think it's a perfect world. But
I
apologize.
No. And this is why we're talking. But I do think that for the hour the MRI takes, for the hour and a half the MRI takes, I would be okay. I am perfectly. I believe in my nursing care.
Patients codes, and you've got 5 other patients or 6 other patients.
Then
you're in deep trouble. And you know what? Under your nursing license, what does it say? You must be responsible for toward and untoward, for the expected and the unexpected. And that's why these limits make sense.
They do make sense. All right, so we could do these what ifs forever, but we're going to move on. So that's somewhere where we're a little bit rubbing, but I love this, and this is why we're talking. So, comment section below, let me know, what are you still concerned about after hearing their side? If there's no, if you're done having the argument, you've decided, great. Let me know why you've decided, all right? And if you still have questions, like I said, down below, I'll contact them every Friday up until November 6th. The Nursing News, I will give you guys updates. Thank you guys so much. Again, shout out to MNA for coming out. Thank you. ANA, I really want to hear from you, so please and thank you. Catch you guys later. Don't forget to like and subscribe, and most important, especially for this, comments down below. Deuces.